Welcome back. We're glad you are still with us. Now, ectopic pregnancies cause many health complications, especially for women who may not even be aware of the condition. Ray Polo talked to two mothers who survived ectopic pregnancies and are now warning other women not to ignore abdominal pains, even when they're on family planning.
When Mildred Olande and her family landed in a foreign country some years back, she blamed the new environment for her strange body pains. She was not planning to get any more babies. Therefore, pregnancy was but a foreign thought.
I knew very well I was well protected. I wouldn't get pregnant. I was Googling for kidney stones.
However, persistent pain pushed her to the hospital. The first two doctors treated her for an infection without testing for pregnancy.
The first doctor gave me antibiotics for UTI. After the medication, the pain came back again. So he thought that the family planning had given us some infection. So he gave me another dose of antibiotic to clear that up. So I took that for 2 weeks. After 2 weeks, the pain came back again.
Her quest for a third opinion saved her life.
So when I went for the scan, they found that I was expectant and the baby was on the embryo was on the fallopian tube.
Mildred had suffered an ectopic pregnancy, just like Caroline Okundi.
I woke up one morning and I discovered that I had severe low abdominal pain. The pain was not just in the lower abdomen, it was shooting through to my shoulder blade.
By sheer instinct, Caroline ran online to check out the symptoms of an ectopic pregnancy. She could not have been more accurate.
It so happened that the ectopic pregnancy ruptured. I bled, and then the blood clotted inside the uterus. So that is what saved me.
Failed family planning methods and biological changes in a woman's body complicate diagnosis of ectopic pregnancy.
Somebody who has ectopic bleeds. Why is that bleeding? Because the uterus was thickening, ready to receive a fertilized egg which never arrived. So the uterus is frustrated and so now bleeds. So that's why then you wonder, am I bleeding because I have a miscarriage? Or what? So you do the scans, you can't see any pregnancy inside the uterus.
Other than vaginal bleeding, some warning signs of an ectopic pregnancy include severe lower abdominal pain, pelvic pain that may radiate to the shoulders, fainting and shock. These confusing signs may delay diagnosis.
The pregnancy, by the time we were discovering it, it was 3 months. Yeah, it was 3 months and it was really risky. That's why when they just found out that I have the ectopic pregnancy, they took me straight away for surgery. One of the fallopian tubes had to be cut. So it can't function.
I did not know that an ectopic pregnancy is life-threatening.
Caroline and Mildred are lucky to have survived ectopic pregnancy, but how many other women succumb to the condition even without realizing they were expectant?
Yes, ectopic occurs in a lot of people who do not think they are pregnant, and it can be very deadly.
The prevalence of ectopic pregnancy in younger women is worrying.
It happens randomly, but I've been surprised to see it in younger people, the more younger people. And a lot of this, if you go through proper history, you find abuse of emergency pills.
Strangely, an ectopic pregnancy can occur in or around the uterus. The fertilized egg may not exit the ovary. It may also be stuck in the fallopian tube and rupture due to pressure. The fetus may also move down the cervix or may drift to the abdomen and cause complications.
Especially if the ectopic ruptures, the bleeding is so much that people get to hypovolemic shock and die.
When picked early, an ectopic pregnancy can be treated using a drug known as methotrexate, which dissolves the fertilized egg. A doctor may also recommend surgery.
2, 1, go!
In all, medics and survivors say there is hope. A woman can conceive and have a baby even after an ectopic pregnancy.
Yes, I had one more pregnancy after the ectopic pregnancy. The boy is 3 years old today.
Of course, 9-10 months later, we had our beautiful daughter.
She was very beautiful and very outgoing. And she's now 4 years old.
We are best of friends in the house, and Mildred can attest to that. And it's because of what I went through to have her, you know.
Doctors advise women of reproductive age to be alert and demand pregnancy tests whenever they experience changes in their reproductive system.
It's something that healthcare providers must watch out for. Don't care whether the woman tell you I got my periods last week or I'm on my periods right now and I'm on family planning. Just go ahead and do your pregnancy test just as a routine thing. And by doing that, you'll be able to save many lives because you'll be able to pick a more ectopic pregnancy than relying on just the history and what you're being told.
Family support also goes a long way.
It was so difficult, but I have a wonderful husband. He was there for me. I was sick the whole time. He would wake up, prepare the kids, cook, do everything, and work at the same time.
It's really good in such circumstances for us men to give the support, you know, to support our wives, because pregnancies they can be complicated sometimes.
Ray Polo, Citizen TV.